Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The promise of ARPA H isn't just speed, but intention. Building ambitious research programs around patient impact rather than hype. One of its newest efforts aims to make cancer treatment simpler, more accessible, and easier to deploy. Here to explain the vision behind OneCure is the program manager, Dr. Wilfred Ngwa. Dr. Ngwa, thank you so much for joining me today.
Thank you very much. Glad to be here.
ARPA H announced a program last month called OneCure, and it's a really ambitious idea using a single, widely accessible treatment approach across many kinds of cancer. When you think about this, what problem is the OneCure program trying to solve that existing cancer research hasn't been able to crack?
Yeah, no, that's a great question. So, in the United States, there are about 2 million new cancer cases every year. There are about 600,000 deaths. There are hundreds of different cancers. Patients have to deal with high cost, months of grueling treatment. Sometimes you can go into years of treatment. And so, ARPA H, obviously focusing on bold, high risk, high impact approaches. So we thought, why not change this? Why not change this for American populations so that you don't have to, go through all these months of grueling treatment, pay this high cost, So that's why we came up with the one comprehensive universal radiotherapy approach for everyone. And the really great thing here also is that this approach can work for multiple cancers, so not just one cancer, because cancer has hundreds of different types of cancers. And so each one of these different cancers has a different treatment approach. So what if you could just have one radiotherapy approach that's low cost, and you can use that for treating all kinds of cancers?
At a high level, how would this approach work? You've just described hundreds of cancers. They all manifest differently in the body. How could you have one solution?
Yep. So this is really the important question to ask. The way our bodies are designed to fight disease is through our immune system. And so remember that cancer is just part of your body that goes rogue. And it starts to divide and grow, but your body never really knows that it's a bad thing. And so if you can show your immune system that the cancer cell is bad, then your immune system can take care of the cancer. And so the approach here is essentially use this one radiotherapy to damage the cancer and force the cancer to take off the camouflage. It normally hides itself from your immune system. And so you force it to take off that camouflage, and then your immune system can say, so you are bad. You're not really a healthy cell. And the immune system can take over the process of eliminating this cancer. And because you're just showing the cancer to your immune system, it doesn't matter what type of cancer it is. All you just need to do is show your immune system that this cancer cell is bad. And so we use this approach using radiotherapy to do that.
And the radiotherapy is one part of the solution set, right? What is the other part?
Yes, you're absolutely right. So radiotherapy is just one part of the solution. You use that mainly to damage the cancer, force it to take that camouflage off itself. But cancer itself is very adept. It's very smart, trying to find ways to evade the immune system. And so the second part of it, and this is a really critical part of the program, is number one, we use what we call smart radiotherapy biomaterials. These smart radiotherapy biomaterials force, they target the cancer, and they force the cancer to be shown to be expressed to your immune system, so that your immune system can now take over the process. So you can think about these smart biomaterials as the ways that empower your immune system. Your SEAL Team 6. If you think about SEAL Team 6, that attacks the cancer, it gives it ammunition to be able to then attack the cancer. So that's one critical component of the program. The second one is with the advent of artificial intelligence, we don't want this to work only for some patients. And so with AI now, today, we can actually develop what you call a treatment planning system that can allow you, if you're coming into the clinic and you are a patient, say pancreatic cancer or lung cancer or breast cancer, if you put the type of cancer into that treatment planning system, tell what the size of the cancer is, where it has spread, you can use that system with the help of artificial intelligence to make a treatment plan and say, use this amount of radiotherapy and this dose of the smart biomaterial to be able to empower your immune system to cause a regression of the cancer that you treated. So that's the second component of that.
I'm speaking with Dr. Wilfred Ngwa. He's the program manager for the One Cure program at ARPA H. Will, one of the things that stands out about this program is its focus on low-cost, widely available treatment. Why was affordability and global access built into the design from the start?
Yes, affordability is really it's really at the core of this program, because we know that patients deal with a lot with financial toxicity. So we say not only the treatments that we have for cancer today are toxic, patients always have to deal with financial aspects of that, right? And so we wanted to make sure that, this is accessible to everybody. So that's why we say one comprehensive universal radiotherapy approach for everyone. And so the critical component here is by using that smart biomaterial, we can use a very small amount of drug. So if you think about today, you are taking your chemotherapy or immunotherapy treatment, literally you get infused with, these drugs. You take these drugs over and over for weeks and months and years. But if you are using this smart biomaterial, you can target a very small amount of that immunoadjuvant or drug so that it goes only to the cancer. And then is released gradually over time to then empower your immune system to take over. So you don't have to keep injecting drugs over time, week after week, into years. And so that really goes to saving the cost for patients. And you can go back to your work, and to your family. And that's really critical because, nowadays in the United States, cancer treatments can cost hundreds of thousands of dollars, and many people cannot afford those.
That is an exciting prospect. Yeah. If you're a cancer patient today, what should you be thinking about in terms of the timeline that this program might deliver results?
Yes, ARPA H is, the director usually says ARPA H is like a time machine, right? So some things that take, decades, we can shrink that down to a few years. So the program is planned over 5 years. The goal is that, we can put together really the best team, the best minds across the U.S., including across the world, who can really be part of this. Think about an Avenger team against cancer. And they will really work within these 5 years, where we can move that from, engineering these biomaterials and the treatment planning system. And then by the time we reach year 4, we can actually start, clinical trials, which is really going to be important for that clinical translation so that, cancer patients today can be able to access that. Now, I would say ARPA H is really unique here because typically these things can take decades. But, with our flexible funding and the ability to, build these kind of teams, that makes it really accelerate the process.
And as you go through the research, ARPA H sits at the center of that. What is your role in orchestrating research at a variety of different sites and labs and technologies? Yeah,
so as a program manager, that's a really great position to be, is that, right now we're just, we launched the program, but we let everybody be able to provide their ideas. And then this can be across different institutions, across geographies. So, and then I build a team. So the team can be from Florida, can be from California, can be from Washington, D.C. And so I bring all these people together to start working on this project. And so my job is to go across, meeting these teams, monthly sometimes, making sure that the work is going forward. And so it brings people literally across geographies. And my work as a program manager is to, work with these people, facilitate that.
I've been speaking with Dr. Wilfred Ngwa. He's the program manager for the One Cure program at ARPA H. Thank you so much for sharing this exciting possibility with us.
Thank you so much, Terry. Thank you for having me.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.